Hello, welcome to Đồng Nai Radio and Television Stations. Here comes the latest updates. The Prime Minister issued Directive Number 16 on the implementation of urgent measures to prevent and control COVID-19. Accordingly, the implementation of social distancing is within 15 days from 12 a.m. April the 1st on national scale.
This distancing is based on the principle that each family isolates itself from other families, one village from other villages, one commune to other communes, one province from other provinces. People who work in workshops or production factories must ensure a safe distance, wear masks, perform disinfection and sterilization according to regulations. People are requested to stay at home. They should only go out in case of necessity, such as buying food, medicine, emergency, working at factories, production establishments, or business establishments. Essential services, commodities, and other emergencies are not closed or shut down. People must strictly observe the minimum distance of 2 meters when communicating. Do not concentrate more than 2 people outside the workplace, school, hospitals, or in public places.
What outstanding research have Vietnamese scientists contributed to help the country take the initiative in dealing with the COVID-19 pandemic? Let's take a look at the following to post about the national science.
On February the 7th, the Central Institute of Hygiene and Epidemiology announced the scientific achievement of successfully cultivating and isolating SARS-CoV-2 virus in laboratory, paving the way for vaccine preparation. On March the 3rd, the Institute of Biotechnology announced the SARS-CoV-2 virus diagnostic kit to meet the standards of the World Health Organization (WHO). On March the 5th, the Military Medical University chaired and coordinated with a technology company to announce the SARS-CoV-2 virus diagnostic kit, costing 400 to 600,000 Vietnam dong per test, equal to a quarter of the foreign price, licensed, mass-produced, and exported to Ukraine and Finland. On March the 13th, Institute of Health, Occupation and Environment, under the Ministry of Health and Hanoi University of Science and Technology, introduced the disinfection trim. Takes only 15 to 20 seconds to disinfect the whole body. The maximum capacity is 1,000 people per day. On the same day, Hanoi University of Science and Technology announced a simple isothermal kit, providing great support in terms of cost, resources, and manpower for the test, currently being supported by the Institute of Hygiene and Epidemiology to evaluate and provide scientific evidence for improvement.
The United States officially outnumbers China, where the COVID-19 outbreak began, in terms of deaths. U.S. President Donald Trump at a press conference on March the 31st said, "The next 2 weeks would be extremely painful."
In a White House press conference calling COVID-19 a disaster, President Trump warned, "It will be 2 weeks of great pain, very, very terrible pain. I want all Americans to be prepared for the tough days ahead. This is not a flu. The disease is very cruel. However, there will be light at the end of the tunnel and America will certainly get better." Also attending the press conference, White House COVID-19 response coordinator Deborah Birx published a chart showing that the number of COVID-19 deaths in the United States could range from 100,000 to 240,000. Report by a group of economists of Goldman Sachs Group stated that due to the effect of COVID-19, the U.S. economy will decrease by 34% in the second quarter compared to the same period last year, a larger reduction than the group's previous forecast of a 24% decrease.
The number of infections and deaths from COVID-19 continues to rise sharply in Europe and North America, causing mourning in many countries. By 6 a.m. April the 1st, Vietnam time, all over the world, there were 854,269 cases, 42,025 deaths, and only 176,908 cases cured of this disease.
According to Worldometer data, the world has witnessed 29,740 new cases and 1,353 new deaths, showing the speed of spread and the terrible consequences of the pandemic. Countries affected by the herd immunity ideology, such as the Netherlands, the UK, and Germany all recorded very high numbers of infections and deaths. The 5 countries with the highest number of cases globally today, from high to low, are the US, Italy, Spain, China, and Germany. In terms of deaths, Italy is the deadliest place with 12,428 cases. The second is Spain with 8,464 cases. There have been 4 countries that outnumber China, where the outbreak began in terms of deaths, namely Italy, Spain, the US, and France. The superpower US, after a period of attacking China over the COVID-19 issue, is now leading the world with 185,707 cases and 3,779 deaths, a very high number, and currently lacking medical equipment to cope with this pandemic.
That's all of the news for today. Thank you for watching and goodbye for now.